Hi, my name is Haley Smith, and today we are going to be performing enema care on our patient. So the first thing we have to do is state our first five. So first we perform hand hygiene. Then we're going to ask our patient for two identifiers, which would be name and date of birth. We are then going to ask them if they have any known allergies. They don't, so we're okay with that. We would then shut the curtain for privacy, or the door. And then we would explain the procedure. So today the doctor ordered a cleansing enema for a patient with a large amount of fluid. So the first thing that we need to do is don our gloves, which I have right here. And then we are going to pour our solution into our bag. For the purpose of this, I am using the catheter bag, but we're going to pretend it's our container for our enema and our tubing. So I'm going to pour about 750 milliliters into the bag, which we have done. The next thing I'm going to do is open up the clamp, and I have a bedside pan next to me. I'm going to prime the tube and make sure that the water is coming out. The next thing we are going to do is position our patient. So we want our patient to be in Sims position. So what we have them do for that is put their right knee over their left leg, and then take their right arm, put it over their head, and the left arm on their side or behind their back. So let me get our patient into position. The next thing we're going to do is lube our tubing. So we're going to lube it about 2 to 3 inches. Put that to the side away from our patient. I'm then going to spread the buttocks and examine for any hemorrhages or fissures. So the next thing we are going to do then is insert our catheter. I'm going to have our patient take a big deep breath in and then let it out slowly. So I'm going to insert the catheter, not the catheter, but the tubing about 2 to 3 inches. I'm then going to grab our bag, hold it about 12 to 18 inches above our patient. I'm then going to release the clamping and let the solution flow. We're going to hold it until all the solution goes. If the patient has any abdominal cramping, we can lower the bag, or we could clamp it for 30 seconds and then reclamp it. So now that the solution is all filled, we're going to put that down. We're going to clamp the tubing, and then we're going to slowly take out the tubing as well. So we're going to have our patient back on their back, and then we are going to ask them to hold it for more than 10 minutes. If they can't, I'm going to place a call bell next to them so they can let us in for assistance. And then I have a bedside commode and a bedpan for them to use. I am then going to take off my gloves, dispose of them, also disposing of the tubing and the volume bag appropriately, and then I'm going to document.